Hello, I will speak today about something we are seeing too much in our clinic, which is the carpal tunnel syndrome. We have in the wrist here what's called a tunnel called the carpal tunnel. As we will see in this video, it will illustrate what is the component of the carpal tunnel and how it occurs, and I will discuss later what is the cause of the carpal tunnel syndrome. As we see in this video, this is front of the hand, and this is a carpal tunnel, which is a C-shaped, and it's formed from the carpal bones. There is a ligament, transverse carpal ligaments, with a tendons surrounded by a chase, and the yellow is the nerve. With repetitive movements and the occurrence with the carpal tunnel, there is enlargement already of the fluids or the chase around the tendons, and makes narrowing for the space for the nerve, leads to compression of the nerve as we see, and the manifestations of the carpal tunnel along the distribution of the median nerve. As we saw in the last video, the most common cause for carpal tunnel syndrome is non-specific inflammation of the tendons in the carpal tunnel, which leads to enlargement of the tendons and pressure on the median nerve, and causing the symptoms of the carpal tunnel syndrome. The patient with carpal tunnel syndrome, also in 10% of cases, there may be another causes, maybe all the fractures in the radius causing compression on the nerve, or space occupying lesion like ganglion or tumor in the carpal tunnel. The patient with the start of the carpal tunnel will complain from pain or numbness will occur in the distribution of the median nerve, which is the medial 3.5 fingers, especially after works. Or with time, the pain and numbness will be increased and becomes continuous. Sometimes this pain and numbness awaken the patient from sleep at night, maybe 2 hours after sleeping, and the patient will make shaking for the hands and compressions for the hands to relieve the numbness and the pain. With time, if the patient neglected this or the management for the carpal tunnel, there is weakness of the muscle, especially of the thinner muscles around the thumb. It will become flat. That's why when you feel this pain, you have to visit your orthopedic. He will manage your carpal tunnel. Otherwise, with time, the numbness and the pain and weakness of the muscle will occur. What is the management for the carpal tunnel? We're starting the management if the patient came to us with the nerve conduction study. It will show us there is a mild, moderate, or severe compression on the median nerve. With mild and moderate cases, we're starting with the rest of the hand, especially at night. We have to rest the hand to avoid repetitive use in the hand flexion and extension. That's why we are using the wrist splint. And sometimes we are giving neurotonics. If this didn't manage to relieve the pain, the next step, we can inject the carpal tunnel as we see in this photo with corticosteroid. It will lead to reduce the inflammation in the tendons and the compression on the nerve, and the manifestations may be relieved. If this all failed to relieve the pain and numbness, or in severe cases of carpal tunnel syndrome, we have to do a surgery. Surgery in the carpal tunnel ranges from minimally invasive, like small opening here in the proximal crease of the wrist to release the carpal tunnel and relieve the tendon, to a small minimally invasive incision in the palm, as we see in this photo. Sometimes we are doing, who is specialized in this, by endoscope to cut the ligaments of the carpal tunnel and enlarge the space and give space for the nerve to relieve the compression. In most cases, the surgery will succeed and there is no recurrence, and the patients will improve completely. Sometimes the complications of surgery, infection or fingers or hand stiffness, or recurrence. In a small percentage of the population, there is recurrence because of the incomplete release of the carpal ligaments, or another cause for the carpal tunnel. We didn't succeed to diagnose it. I hope this entity will help you to know the carpal tunnel manifestations and the management, possible ways of management, and when you visit your orthopedist, and don't neglect this one. Thank you.